I want to be a competent, board-certified orthopedic surgeon. What do I need to accomplish to get there? How do I track my progress? The mission of the American Board of Orthopedic Surgery, the ABOS, is to establish education and performance standards for orthopedic surgeons. Traditionally, residents have been required to spend a certain length of time in individual subject areas. However, those time-based standards are changing. One example of a recent change is the implementation of increased flexibility in the time requirements for orthopedic residency training. To become ABOS board certified, residents must complete 60 months of training in an ACGME accredited residency program. The ABOS has mandated that no resident spend more than 50 weeks per academic year in residency educational activities. In addition, the 46 weeks of educational activities that are required of orthopedic surgery residents each year may now be averaged over the 5-year residency, rather than a minimum 46 weeks each year. These areas of flexibility are intended to not only ensure that residents have time allotted for vacation, but also have time to deal with life's expected and unexpected commitments, while still allowing sufficient time for their education. Over the past several years, the ABOS has also introduced and expanded a knowledge, skills, and behavior program as part of setting standards for residency education. This program has been developed with collaboration from AOA CORD, the ACGME, the AAOS, and with many residency programs across the country. The ABOS's goal in this collaboration has been to create a better system for measuring progress in residency education, a program that assesses competency and provides feedback to residents and program directors in real time. Our expectation is that this new program will benefit residents, programs, and ultimately patients. In this program, knowledge is measured through the Orthopaedic and Training Examination. The OITE is developed and administered by the AAOS. However, the ABOS and AAOS are now working together to make the OITE an even better assessment and aligned with the ABOS Part 1 examination blueprint to ensure that the content on both examinations encompasses similar orthopedic knowledge areas. Surgical skills are measured using a workplace-based assessment. The ABOS has developed and validated the OP Surgical Skills Assessment tool, which many residency programs are already using. After participating in a surgery, a resident can use their smartphone to request that the attending surgeon evaluate their performance on that surgical case. The faculty member immediately receives a text or email and can complete the evaluation to provide feedback in real time. Residents can then review areas of strength and areas for improvement for each specific procedure. Residents are able to view their overall competency level for specific procedures, as well as monitor their growth and progress over time on their password-protected, secure ABOS resident dashboard. The ABOS has identified 35 Tier 1 core orthopedic procedures, as well as 53 Tier 2 exposure orthopedic procedures that should be assessed during residency training. Don't worry, an orthopedic surgery residency lasts for 5 years. No one is born a surgeon. It takes time to learn surgical skills. The goal of this program is to provide feedback that will help you improve over time, with ongoing exposure to multiple different surgical procedures. Finally, the ABOS has developed a professional behavior tool that allows program directors and faculty members the opportunity to evaluate the professional behavior of orthopedic surgery residents in several domains. Similar to the surgical skills tool, the resident requests an assessment from faculty at the end of each rotation. For confidentiality reasons, the results of the behavior assessments will be collated and distributed by program directors at regular intervals. The ABOS invites all orthopedic residency programs to participate in the valuable ABOS Knowledge, Skills, and Behavior program. The tools that the ABOS has developed are designed to be easy to use and to minimize valuable resident and faculty time to complete the assessments. For example, the Surgical Skills Evaluation tool allows residents to easily request evaluations from attending surgeons. A resident can simply navigate to www.abos.org/r and log in with their username and password. Select the subspecialty of the procedure to be assessed, the specific procedure, the attending faculty who is present, and the date and time of surgery. Clicking Submit will automatically send a text message or email to the faculty evaluating the resident's performance. The faculty member chooses how they receive these requests, by text or email. The resident will be alerted immediately after the assessment has been completed. By clicking on My Skills Assessment, residents may review all of their completed assessments. Residents may also update their contact information on My Profile. The ABOS Knowledge, Skills, and Behavior Project is designed to provide you with framework of what you need to know to become a competent orthopedic surgeon, as well as allowing you to easily track your progress with real-time orthopedic knowledge, surgical skills, and behavior performance feedback during your residency training.